So what is vulvar and, let me say that again. What is vulvar and vaginal cancer?
Okay. So first, a little bit of anatomy. So the anatomy of the vagina, it starts at the cervix and it opens at the vulva, which is basically considered the external female genitals. The vagina is usually collapsed with the walls of the vagina touching each other. And the vaginal walls have many folds and basically allows the vagina to be opened and closed during sex or birth of the baby. As far as the vulva, that is the outer part of the female genitals, and so includes the opening of the vagina. Sometimes it's called the vestibule. It includes the outer lips of the vagina, which is called the labia majora. It includes the inner lips of the vagina, which is called the labia minora, and the clitoris. There's also glands that are found just inside the opening of the vagina. There's one on each side. These glands are referred to as the Bartholin glands, and essentially they produce fluids that act like a lubricant during sex. And so when there's cancer in basically any part of the vulva or the vagina, you essentially have cells in that region of the body that have just started to grow without control or in an uncontrollable way, and they just expand outside their area. Because of the different types of cells that are there, as you might imagine, there's lots of subcategories or different types of cancers in those regions.
What are the different kinds of...
I try to make it like I threw you, like I lobbed you a ball so you get a home run.
Dr. Tom, what are the different kinds of cancers that are found in the vagina and the vulva?
I'm so glad you asked. So because there's a lot of similarity, a lot of overlap between these two types of cancers, rather than saying like the same thing twice, what I thought would make more sense is just to say, okay, there's different cells at both parts of the anatomy. There are squamous cells, which are flat cells. If any squamous cell becomes cancerous, you could have squamous cell carcinoma. So what that means is you could have a squamous cell vulvar cancer, or you could have a squamous cell vaginal cancer. So using that same logic, we have other types of cells that that are basically glands in or around that area of the women's anatomy, and those could be adenocarcinoma. So these are basically cells from glands that usually make hormones. There could also be other types of cells that produce pigment, and those types of cells then would be like a melanoma cancer. So you could have a melanoma of the vulva, or you could have vaginal region of the body. There's also then cells that can spread. So these other cells could be from the cervix or the uterus or the rectum. In other words, there could be surrounding tissues where cells become cancerous and they could spread to this part of a woman's anatomy. There's also sarcoma type cancers, which would be like the cells come from either bones or muscles or connective tissue. And then, of course, there's basal cells, and so there could be a basal cell carcinoma. So essentially, you have some cancers that are rare, but there's several subtypes that can occur in this region. The reason why knowing the subtype matters, whether it's a subtype of vaginal cancer or a subtype of vulvar cancer, is that's going to then determine what's the best type of treatment to pursue later on. And this gets back to, we talked about women on a previous episode or podcast, women having a fear about a biopsy because they're worried about the cancer spreading. But they're ignoring the fact that if you don't know what the enemy is, how are you going to fight the enemy successfully? So they're taking a fear and letting that fear guide their decision making, when they should be saying, how can I learn more about what's inside me so I can make a better decision?
We're talking with Dr. Tom. This is the Ask Dr. Tom show, and today's topic is vulva cancer and vaginal cancer. So, Dr. Tom, what are the statistics for vaginal and vulva cancer?
So for vaginal cancer, so we'll start off, it's rare. It occurs in 1 out of about every 1,100 women. So it's much lower stat than, let's say, other types of cancers we've discussed previously. And some of the 2019 American Cancer Society estimates for vaginal cancer in the United States, there will be 5,350 new cases in 2019. There'll be 1,430 women will die of this cancer. Now, if we shift to the vulvar cancer, we'll say the same, 2019 American Cancer Society stats. There'll be 6,070 cancers newly diagnosed, in terms of vulva cancer in women, and about 1,280 women will die of this cancer. The vulvar cancer accounts for about 6% of cancers of the female reproductive organs and about 0.7% of all cancers in women. So women have a 1 in 333 chance. So the likelihood of a vulvar cancer is 3 times more likely, roughly, than having a vaginal cancer. So just to put things in perspective, but they're both they're kind of on the rare side. You're more likely to hear about stuff, ovarian cancer, breast cancer, let's say, than these types of cancers.
And because of that, then what are some of the risk factors for vaginal cancer and vulvar cancer?
So starting with vaginal cancer, age is a risk factor. So about half of women that are diagnosed with vaginal cancer are age 70 and above. Some women do get it less than 40, but generally speaking, it's over the age of 70. Exposure to DES, diethylstilbestrol, which was a drug used between 1940 and 1971 to prevent miscarriage. It's now been sort of uncovered that this drug may be linked to different types of reproductive cancers like vaginal cancer. There's a condition called vaginal adenosis, where basically there's a change in the shape of some of the cells in the vagina, and that could lead to long-term getting vaginal cancer. There's also a link to HPV, specifically HPV 16 and HPV 18 and vaginal cancer. Women that previously have had cervical cancer or pre-cervical cancer condition may be at risk for developing vaginal cancer. Smoking, alcohol, HIV infection, and vaginal irritation have all been linked or increased risk for vaginal cancer. As far as vulvar cancer, some of the similar areas of concern, so age, the difference would be that with vulva cancer, less than 20% of the cases are in women younger than 50, and more than half are women over 70. So you could just simply combine the two and say women over 70 are at a greater risk for vaginal or vulvar cancer. Women with vulva cancer, women have a risk for vulva cancer if they have HPV, in this case, HPV 6 and HPV 11. So whether or not someone needs to remember all the subtypes of HPV, what you sort of take home from this is that HPV increases the risk for cancers of the reproductive tract in women. Outside of that is smoking. As we mentioned with the vaginal cancer, smoking also increases risk for vulva cancer. And then HIV infection. And then there are other types of conditions like some changes in the cell types that like in the characteristics of the cells, exposure to other types of genital cancers may, during a treatment, or the cancer themselves may increase the risk for vulva cancer. And then having moles that undergo some form of dysplasia, meaning there's changes in the moles that don't get addressed. So the reason why we summarize these two, because there's a lot of similar things, and basically smoking, alcohol, HPV risk, and age would be some of the big ones. And then some of the minor ones that not as many people will probably encounter will be HIV infection, and then some changes like inflammation in different cell types within those organs, those areas of the body.
How can women reduce their risk of developing these cancers?
So there's a number of ways. One would be to avoid, or limit HPV. So anything that women can do to avoid HPV infection. So a common thing would be like condom use. If they're if sexually active but not in a serious relationship, get vaccinated if they're young enough. Don't stop smoking or don't smoke. Get regular pelvic checkups, and get things like Pap tests, other types of pelvic examinations, and then do their own self-exam.
And we're talking with Dr. Tom, and this is Ask Dr. Tom show. You can get your episodes of this episode, or your copies or your downloads of this episode and previous episodes, where we go through different cancers. So today it's vulva and vaginal cancer, but we've talked about all of the big ones and some of the ones you might never have heard of, and they're listed and cataloged for your listening at iTunes or any place you get podcasts. So you could go there, subscribe. What are the signs and symptoms of vaginal and vulva cancer?
So let's start with vaginal cancer first. And so abnormal vaginal bleeding after sex, abnormal vaginal discharge, a mass or lump in the vagina that can be felt, or pain during sex. Those are some of the common ones early on. And then in terms of once cancer spread beyond the vagina, some of the more advanced type of symptoms would be painful urination, constipation, pain in the pelvis or in the lower abdomen, back pain or swelling in the legs. In terms of vulva cancer, there's some slightly different types of symptoms. For certain forms of vulva cancer, there may be no symptoms at all. In other areas, there may just be like some swelling and a discoloration of the skin. So it may be lighter or darker than normal, or than the skin around it. There could be a bump or a lump, and it could be colored red, pink, or white, and have like a surface that looks like it's got warts on it. The skin could be thickened. It could be itching. It may be painful and burning. There could also be some bleeding or discharge. So there's definitely some similar type symptoms, but the main take-home point is most women know how their body works in terms of, how it feels when they urinate, when they have intercourse, things like that. If something feels different, rather than waiting and seeing what happens, just make, an appointment with your obstetrician, gynecologist, and have them check you over and just make sure, hey, it's no big deal, or hey, it's something that needs attention, and then get the workup right away, because, it's a lot easier to treat it when it's, barely spread to any other part of the body.
Are there tests that ladies can get for vaginal cancer or vulva cancer?
Yeah, there are. And so let me I had a pretty long list here, so let me just kind of summarize it with, so first, it starts off with you see the doctor and you get an exam. The doctor then kind of looks you over physically, gets your family history, and says, all right, based on what I'm seeing, we need to do some more testing. And they might do things like some imaging. It could be anything from ultrasound to an X-ray to a CT scan to an MRI. If they think the cancer's been going on for a while and it's spread to your lungs, they may do an X-ray of your lungs. And if they think it's spread around the body, they may also follow up with a PET scan. If they see a lump or an area from one of the diagnostic tests, like the imaging, then they may order a biopsy. And then once the biopsy's done, there could be all kinds of genomic testing done. We're going to look for, one, what type of cell line, like is it a squamous cell versus a basal cell versus melanoma, and what type of mutations are found, because that will help the doctor to know what some of the best treatments would be to kill those cancer cells.
And so then what kind of a doctor treats vulva cancer or vaginal cancer?
Yeah, so this is one of those things that I want to make sure people are aware of, is that so what I hear a lot of times is people come in and they'll say, oh, my doctor didn't know anything about, nutrition or diet or exercise or some, light therapy. And what people need to realize is that most doctors are specialists in some form or some way. So when you see, for example, a gynecologist, while doctors in med school, doctors are educated about a lot of different areas. As they progress in their medical, education, they become more focused and more narrow. And so, a gynecologist is a physician that specializes in diseases of the female reproductive tract. A gynecologic oncologist is a doctor who specializes in treating cancers of the female reproductive system, and that doctor may do surgery and chemotherapy. A radiation oncologist is a doctor who uses radiation to treat cancer, and a medical oncologist is a doctor who uses chemotherapy and other medicines to treat cancer. The point about all this is nowhere in their expertise and their training was there stuff on exercise, nutrition, light therapy, etc. And so, or magnetic field therapy. So you can't expect those doctors to know about those areas because that's not part of their academic preparation. Now, what I will say, what's a challenge right now with healthcare is, generally speaking, we tell people before you start a new diet or exercise program, make sure you get your doctor to sign off that you're healthy enough. So a doctor's just going to look at it, is your heart, your lung, maybe your liver and kidneys, everything functioning well enough so that you can engage in activity without an unnecessary risk. But the doctor is not going to design your exercise program for you. The doctor is not going to design your diet or nutrition plan for you. They might just say, hey, you got to stop eating junk food. It's going to be very general, very non-specific. So people need to manage their expectations of what information to get. And so, for example, along the lines of what I suggested earlier, if you want to know about chemotherapy drugs, then you would talk to your medical oncologist, or if you've seen a gynecologic oncologist, that's who you would ask because that's in their wheelhouse of expertise. But you're not going to ask them about curcumin and vitamin C and green tea because that's not what they're trained on.
Yeah.
You need to find a different professional that has expertise in that area.
How can Causenta help patients suffering from these reproductive cancers?
Well, one, we can create all kinds of complementary strategies so that no matter what form of these reproductive cancers someone has, we've got some amazing results. And the thing is, as patients go through our system or our process, whatever term you want to use, they look better, they feel better, they're physically stronger. We could actually show data that they're gaining muscle and losing fat because we actually do body composition testing. Because one of the things we uncovered many years ago is that if we could add muscle to patients, we're changing the environment in the body from an inflammatory catabolic state to an anabolic state, which means we're winning the war slowly against cancer. And particularly with some of these reproductive cancers, like things like breast cancer, ovarian cancer, vaginal cancer. I don't think I've seen a vulva cancer. I'd have to think about that off the top of my head. I can't recall one. But for the other cancers, every woman that's come in and followed a program is alive and doing well today. We have now women coming back for like second and third year follow-up that they've been no evidence of disease with some of the newer systems that we've been doing. And we're always getting new stuff in because we always believe that we don't know enough and there's always more that we could do. So it's like this driving force to constantly make what we're doing better. And the end result is patients really benefit by getting faster results than anywhere else they could have gone.
So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is a standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, We're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to Causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.